So after you've done your initial evaluation, your RT and nursing staff are gonna go through this little grid. And that is gonna attribute points to your symptoms or what your patient is presenting as, and it'll tell you, yes, this is an effective therapy for these symptoms, or no, perhaps they're just hypoxic and we would do oxygen therapy instead of any type of flow assistance. So really what this is gonna do is take that little bit of work of breathing away. This is not going to correct any type of accessory muscle use. It's just gonna make it less difficult for them. So on this machine, we have our water that trickles down into our water reservoir, our little heater. Now, it's a little deceiving that there's only this much water in that humidifier and it seems like it's empty, but it's not. It only holds that much water so it can get a correct temperature reading. So all of these wires, these gray wires, are temperature probes. And so we're gonna measure proximal to the humidifier the temperature, and then this machine will also, these wires, will allow for us to measure temperature proximal to the airway. And so that's super important because if we have a blanket covering this, or we have any kind of fan blowing on our patient, it's going to change the temperature artificially, and this machine is going to try and correct that. So we want to make sure there's nothing blocking this. When we've gone through our evaluation, we're going to determine then how much flow we need, and then we're going to adjust our FiO2 to achieve or maintain our stats. So what we would do is this oxygen tubing works not only for oxygen, but it also gives us the ability to deliver the flow, the oomph, the push, which is what's going to get this support to the patient. All right, and then after we've had this established, we're gonna titrate our FiO2.